And we're on. Dr. Jenna Scare, thanks for being on Fitness and Consciousness.
Thanks for having me. I appreciate it.
So I found you on Instagram, and you're doing um, a lot of different kinds of movements. Some of it's like yoga stuff and handstands and kettlebells, and you're also a physical therapist. So I guess let's start at the beginning. Like, what got you into the movement practices and your strength and conditioning movements to begin with?
I guess I've always been a mover. Back in since I can remember, we had to be in a sport growing up. So gymnastics is the one I happened to stumble upon. So I knew a lot about body weight movement because that's what gymnastics is. And once I quit, I found Pilates because it really resonated with me in that sense. It felt like gymnastics conditioning by doing Pilates. So I loved that and I really got into that. And then in grad school, I got into weightlifting with some of my friends. So every lunch break, we would go to the gym and do some kind of workout. So I got more proficient in my weightlifting. And then through the years, I've just met so many different people. So I have helped with yoga and kind of taught yoga. I taught Pilates. I've met friends in Animal Flow. I've met friends in kettlebells. I've met all these different humans and individuals and movers. I got into the calisthenic community and competed with that. I did acro yoga. So I just love to move and I'm open.
Yeah, there's so many cool things happening now. It's like it's a really good time, I think, to be in the business and or just a practitioner of these different strength and movement flows, because
Mm-hmm.
it seems like there's something kind of like new and different coming out all the time somehow. It's like there's these never ending possibilities. So as a physical therapist, when you're looking at these different like movement systems, um, like, what do you like gravitate towards more? I mean, you just named a lot of things that you were into, from gymnastics to the Pilates and all, but like with the education that you have, do you see like um, how to like kind of like optimize all these different things to avoid injuries, or to get the, I guess, the best results out of what you want while avoiding injuries? Or how is it that you're going about what you're learning?
Well, I what I bring in person as a physical therapist is much different than what I can bring online. And so I use my expertise to kind of give people the foundational layer, which is mobility. Because if you don't have, if you're limited within your mobility, you're most likely going to be going out and lifting heavy and doing all these exercises without having your foundation set. So, and also I focus in on mobility so much because it is a way that people can kind of assess themselves, like, oh, I don't have good shoulder internal rotation. How can I work on that? So it's a way for people to start to understand their own body and an easy tool to be able to give people to work on their own body. It doesn't have to be so complicated. I know some people are like, well, I want the really cool mobility flow. And I'm like, it looks cool. It probably feels good, but is it pertinent for your particular body? Which is why I break it down exercise by exercise, because it really should be individualized and it should be pertinent to what exactly your body needs, not just everybody, because we're all unique, different beings. So when we're able to dive into our own individual restrictions, that's where things really become powerful and really start to open up so that we can prevent injury, so that we can go into all these different kinds of movement patterns. There's so many movement patterns that I'm obsessed with and I love, and I try so many, and I feel like I have a good baseline because I have that mobility foundation.
Yeah, that makes sense. So I see you offer a couple online programs, and so you're like, I was just reading through some of it a little bit ago, and like you get like 12 new like workouts per month. So, or is it like going in? Are you teaching like in progressions of like you start off with these mobility drills and these like movement flows, and then it leads into like the more and more complicated ones, or how does it work?
So it really is dependent on each person. Um, so I have two different programs. The mobility method is the one where it really becomes individualized for each person. It's a one-time payment for lifetime access of all these tools, which is really powerful because you get a full screening assessment. So you get to see exactly where your limitations are within your body. And then you have breakdowns of every mobility exercise you can think of for the body. And I really go over a detailed way of how to do the exercise correctly, how you can progress or modify it, and how long you should be holding for each kind of stretch or how long you should activate after each stretch. So it really gets into the body as a whole for mobility. But the purpose for that one is for people to go into the assessment and then be able to find the exercises that work for their individual body. For the optimal body, that's where I have just a toolbox that anyone can pull from when they don't have to think. So you don't have to do the assessment. You don't have to do, anything else. You can just pick from exercises and create your own. So I have 4 functional HIIT workouts every month, and they range from a pretty easy one to a much harder HIIT workout. And then I have 4 core stability workouts each month, which again range from level 1 to progressing to level 4. And then 4 mobility flows that target different parts of the body. So the upper body, the lower body, the full body, and the spine. And when I'm going through all those different flows, it's really just a generalized mobility program so that people can kind of get an idea and at least start moving into something. But what I usually guide people toward is the mobility method. I think everyone should have this in their hands so that they at least can find where their restrictions are and learn the tools to get out of those restrictions.
Yeah, what do you find that's like? I know everybody's different. I started as a trainer a long time ago, so we run into different things, but we see kind of like recurring themes, I guess. So, like, what do you see that like I guess holds people back from um, like some of the flows and stuff, like just like as far as getting started with them? Like, you think like a lot of people just think that they um, like, because what I hear sometimes is like people almost like want to get in shape before they come to me or something like that. They have like I've heard that kind of thing. It's like, or like before they take my like martial art class, they're like, oh, I need to get in shape first. I'm like, I don't understand why that makes sense to you, but like I said, do you have like, are there like these recurring things that you see that like seem to be like holding people back from just getting started?
Yeah, I think we have a lot of limiting beliefs that people put on themselves, and judging themselves versus other people. We're in the social media world, so it's all about comparison. Well, I don't look like that person. I don't move like that person. I can't do that yet. And we put all these negative thoughts on ourselves when really it's just about movement. And there's no judgment when it comes to movement because everybody gets to start at a different level. And so no matter where you're at, there's always an opportunity to learn. And no matter who you are, there's still always an opportunity to learn. And luckily for me, I don't run across that as much because being a physical therapist, I see all body types. So it could be someone who's not moving to someone who is extremely active and an athlete. But at the same time, to buy my program, people still do ask, can I be a beginner? Or what if I already, am an athlete? Would this still be good for me? And I'm like, yes, if you're a human, it's good for you. And just like stepping into any kind of workout process, if you're human, movement is good. I mean, obviously you want to progress effectively for your body where your body's at, and you want to be listening to what could be going on. Maybe you're progressing something too fast. Maybe you rushed into this high level class that you weren't quite ready for, which is totally okay. That's okay to start to listen and be like, oh, maybe not yet, but I can take this other class, this class that is a little bit more beginner. And also there shouldn't be ego. It's not about who's better than who, unless you're in a competition. If you're in a real life competition, sure.
Mhm.
But other than that, there's no ego. It's just movement. And just the fact that you're getting out there and moving, who can judge that? You're getting out there and you're doing something. So no matter what your size is, no matter what your athleticism is, no matter what your coordination is, just move, because it's literally been studied that the number one thing to increase longevity is through movement.
Hmm. Yeah, that's really cool to hear. I don't know that I've heard it quite like that. That the number one thing for longevity is the movement. Something that keeps coming up for me is like people's traumas of all sorts, from abuse to like an injury, like fell on my shoulder, and these create um, like maybe like the mental traumas, or would cause like a physical inhibition of some sort, and then like maybe the physical one causes like some sort of mental one. Do you like get into that like part of it? Like, do you see that? It seems to be like this thing that like keeps just popping into my world, and maybe I've been searching it out more, like looking for these different answers of like how to help people. I mean, I'm not a clinician to
Mm-hmm.
do it, but I can see how just like strength and movement can help. But do you dig into like the I mean, obviously physical therapy, it's, there's been some sort of injury a lot of times, but can you just like speak on that? I don't know if I have like an exact question for you, but can you just speak about that for a minute?
Yeah, so I think you're talking more on like how the emotions and how the emotional stress that we put on ourselves and coming from our body can even create pain within the body, which is studied. It's proven. It's a real thing, which is why I don't work in a typical clinic anymore. I
Mm.
treat clients one-on-one, and which allows me to spend more time on them and allows me to get really personal and really deep with them pretty quickly. And what that has opened up for me is the ability to create space for clients. So almost once a week, I have someone crying on my table. And it's not because of pain that I'm inflicting on them. It's really because I'm opening the space to allow them to feel vulnerable enough to release those emotions. And it's not like I'm trying to be a mental health, mental care,
Mhm.
specialist or anything. I'm not being a psychiatrist in terms of evoking questions or evoking emotions. I'm literally just opening and creating a safe space. Because I think, especially when it comes to pain, the one thing that we do is we beat ourselves up. Well, why do I have this pain? I shouldn't have this pain. This is bad. And you start putting it, and it's like a heavy weight. And instead of appreciating, like, oh, I feel this pain, could this be coming from? What could this mean? We beat ourselves up. So it puts a heavier weight on you, and then a heavier weight. And all of a sudden, you're just like compressed and tied up in your body. So by us, like, putting all of that on you, it leads to chronic pain a lot of the time, more stress in the body, more pain in the body, and it really doesn't help to relieve anything. So the one thing that I'm working on with people, the first thing that I'm working on when it comes to pain is, do you have compassion for yourself? Are
Hmm.
you able to say, like, this pain, it's okay, it's normal, it's actually a good thing to be able to feel pain. There's people who don't feel pain. Like when you get diabetes and you get neuropathy, you stop feeling your feet, you start stepping on things and you can't feel it. Eventually your foot gets chopped off a lot of the times. So pain is actually super powerful tool within our body that we need. And it's not something to fear, it's something to be aware of. And it's a really powerful tool. So allowing people to feel like, okay, it's okay, I'm not bad, this isn't bad. And then we get into breath work, which also helps tap into the parasympathetic system to tell your body to rest and relax. And a lot of times when you're in pain, you're locked up within your body and you're not yet releasing. No matter how long you roll on a foam roller, no matter how many massages you do, you're still locked up in your body because you're holding on to that tension of, why do I have pain? And so when I get people to finally tap into that compassion for themselves and allow them to say it's okay, and allow them to get back into their breath in a really effective manner of really being able to rest and relax and release, all of a sudden tears start flowing. And I have people are like, I don't know why I'm crying. And I'm like, I do. You haven't allowed yourself to even step into this, to even be here. So when we allow that space to happen, then sometimes we do start opening up. Okay, what else is happening? Are you going through a stressful time? Are you going through a divorce? Is something else, weighing on you, that you're feeling like you're taking on so many things and you're not allowing your body to just be?
Yeah, it's really amazing. I just finished listening to. I think I've either read it or listened to it before on the audiobook. The Body Keeps the Score, and it's about how the trauma is getting stored in different ways, and sometimes we don't remember traumas until we're later on, like these memories pop back up, but we hang on to them and cause us real stresses from all sorts of different ways. So that's I guess maybe there were like some people that were aware of this for a long time, but it seems to be like something that's like gaining more and more like mainstream, like Western science kind of validation that yes, you do store things this way, and there are ways to release it. It's not just take these drugs and come back when you're out and we'll give you some more. And
right.
So when you're working with somebody that has that happen, and they're having like these emotional releases when you're working on them, then are you giving them like homework, like movement homework that's designed to kind of release more, or what do you do?
Totally. I think it works in multiple ways. So it's always dependent on the person. There's no one size fits all. But definitely breath work is one of the number one things that I allow people to go home with. And it's a really powerful tool, especially when people feel that pain again. When they're able to tap into their breath, they're able to release that moment of pain, because it unlocks and it literally releases in the nervous system. And so when I give people that tool and that ability to find that within their body, it really is amazing what can open up and what can come of that. So that's always the take home tool. That's the primary one, is really getting into that breath work. And I tell people, can you at least give me 5 minutes before you go to bed at night? And then once you get used to that, start doing it when you're driving, start doing it when you're walking, start doing it when you're at work, and we start tapping into this breath and remembering it on a daily basis, and it naturally will eventually start to become part of your life. Also, of course, there's movements that I take home for every client. I use a lot of PRI type work, which is Postural Restoration Institute. And that also is just a different way to really get into that nervous system and help the nervous system to feel safe and in a better alignment, so that you can increase your mobility, so that you can get muscles firing the way that they're supposed to be firing. So I think prior to heavy exercise, prior to, corrective exercises, even understanding and tapping into the nervous system is the most powerful tool that we can really have, which is obviously harder for me to translate onto social media or online. So a lot of the tools that I use to be able to relate to people online is mobility or strength or corrective exercises. But if you really wanted to dive deeper and you were in chronic pain or acute pain, I think going to see someone who's going to tap into that body in that way, it is very, very powerful.
Yeah. What kind of breath work are you referring to?
Really, really basic. So it's really just allowing people to understand where the breath is coming from again. So our diaphragm rests underneath our rib cage. But most of the time when we're breathing up into our neck and up into our chest, and using all these accessory muscles up by your neck to do most of the work. So and what became very common is the hand over the chest, hand over the belly, which is not a fine, or what am I trying to say? It's not a bad place to start, but it also isn't getting the full picture. But it's a good way to just kind of assess real quick. So put one hand over your belly, one hand over your chest. and take a breath in from your nose. And if you feel like your chest is leading the way, your hand on your chest is doing all the work, then you know you got some work to do, and you're probably staying locked up in that nervous system. And when we stay locked up in that sympathetic, it actually releases more cortisol, and we're telling our body we're in this constant level of stress. And when we're doing that, it's increasing the sensitivity into your nerves, and your nerves is what fires back to your brain and says that you're in pain. So if our nerves are firing back to our brain to say that we're in pain at a constant state, we know that the breath has a really powerful tool to be able to get out of that. So then I say, okay, can you put two hands on your low rib cage belly area? Because it's not just about breathing into the belly. If the rib cage isn't moving, then we're not getting a very effective breath throughout that whole rib cage area still. So then that's when I say, okay, let's put our hands on the low rib cage belly area. I want you to feel as you breathe in that your rib cage and your belly is going to kind of expand as one. And as you breathe out, it's going to compress and relax as one. So getting people back into that regular breathing pattern, it can literally change things in an instant. So it's a very powerful tool.
Yeah, it's really amazing, just like how we can, like some of these um, like ancient things like yoga, and like I know like some of the yoga stuff may not go back as far as it's claimed, like the way it's practiced, especially in like a lot of the studios here. But do you like when you like what got you? You probably learn about breathing through like physical therapy school, but like, are you taking your like maybe like what you learned at your like did you go through like yoga teacher training, or you just did the classes? And like what I was saying is like when you have somebody at your physical therapy practice, are you using anything that you like learned through yoga and not physical therapy? Or
Yeah, so a lot of things I've learned that I actually use with clients now is hardly anything I learned in PT school. Physical therapy school is actually it's a great way to receive your license so that you're legal in what you do, and it's a great way to diagnose, whether it's a musculoskeletal injury or is back pain possibly being referred from an organ or something else that we need to refer back to an MD. So that's why I think PT and chiropractors are so important, acupuncturists as well. When a personal trainer or someone or a massage therapist is diagnosing pain, you don't usually, unless you've taken more courses, learned how to differentiate whether that's coming from truly a musculoskeletal problem or deeper into the system where it could be referred from an organ. So that's what PT school it really is great at, learning those differential diagnoses, learning those special tests to be able to say what is actually happening and being able to diagnose that. But when it comes to actually treating and actually healing a client, I think a lot of what I've learned came out of after PT school. I mean, yes, we learn about breath, but we learn about breath in terms of how to get lungs to function properly after they've been in surgery. So it's more talking about hospitalization and respiratory system, which is fine and it's great, but it also doesn't translate to the general population who's coming to see me, who breath could actually be super effective. So a lot of that work I've just learned. I've taken many various courses. So some are related to PT, some are not. So a lot of things I've learned from personal trainers. I've learned some things from yogis. I'm open to learning. There's never anyone who can't teach you something. And I think no one should be so arrogant to think that they know it all or that they can't learn from someone who doesn't have all their, as high of credentials as they do. Because you can always learn. And I have always continued that. I've surrounded myself around mentors and people who've taken me under their wings sometimes and just taught me different things. So I've been very fortunate to continue to learn, and I'm never done. I'm always going to continue to optimize my programs as I continue to learn more. And I'm just always wanting to help people. And that comes with a constant hunger to want to know why and to want to understand the body in a deeper and a better sense. So it's always going to be a constant journey.
Yeah, it is a fascinating thing about the human body that there's people are still like doing new stuff, maybe like kind of like reinventing stuff, but like it's just amazing that we can just keep innovating and moving in different ways, and whether it's like dancing or different, like adding on to yoga or whatever. But yeah, you mentioned like the pain and the personal trainers. Like to me, that's where a definite thing that people, like whether they're yoga teachers or personal trainers, like once somebody has pain, that means you no longer know what you're talking about, and you need to refer them to someone else that does have medical training, because pain can be a weird thing. It's not always um, uh, like what you may think is rational or like what makes sense to you. And
Right.
but there is like the yoga teacher may have like some of the more less um, like maybe they understand like the emotional physical stuff better than somebody with like the certain kinds like medical degrees, or so they're like learning from, oh, okay, this does make sense, like the emotional stuff. And you mentioned like feelings safe, and like the nervous system, and how we can like these movement patterns. So uh, like you might maybe like dig into that a little bit more, like somebody who's um, maybe they don't like move so well because they're like more like nervous, or like or maybe it's like, how can I word it, like maybe like the old person, maybe it's like they walk with like these short steps because like they're more afraid of falling, instead of like they have reduced mobility, so they have reduced mobility because they're afraid of falling.
Mhm.
Does that make sense? My question makes
Of
sense? Does
course.
that work?
Of course. So, our body is always wanting to keep us safe. That's its number one thing. And so if it doesn't feel safe, it's not going to allow you to have the range of motion. So it's the same reason why I can post a video and saying like, you can touch your toes in 5 minutes.
Mhm.
Because if you don't feel safe within your body is not going to allow you to bend forward. It's going to start bending. You're going to start bending forward. Your body's going to be like, we're falling, and literally grab onto your muscles. And it's weird for people to think like that, but your brain has nerves, and nerves are what's going into and feeding the muscles. If they're feeding the muscles and telling the muscles to pull back and stop and restrict, it's going to happen. And so that's often what can, restrict mobility, which is why when people even go into my program, I say the first thing that you need to do is go into the breathing module, because unless you can tap into the breathing module correctly and get that body to relax and feel safe, that range of motion that you're trying to get is never going to carry over. And if you really want to carry over and gain more range of motion and gain that mobility and you have to allow your body to feel safe. It's the number one thing. I had a client, he came to me from New York, where he had been getting treatment for 3 years on his back. And when he came to me, I said, okay, can you bend down and touch your toes? Just a general screening I was doing. And he was like shaking, trying to bend down and touch his toes. Okay, lift your arms overhead. And his arms were like shaking, trying to lift them up. And they didn't even get up very high. And that is a clear sign that someone's nervous system is like, what is happening? And doesn't trust him to do anything. And all they kept doing at physical therapy when he was up in New York was tell him to go to Pilates, because we all think core strengthening for back pain, and your SI is out of alignment, so let me manipulate you real quick. So all they were doing was making him tighter and tighter and tighter. So once we actually got him to get into his body, now he is moving like a champ. And just like you said, having a team of people, now I've released him where I'm like, you don't need me. you need to go with a personal trainer that I trust and that will continue this journey of getting you into that nervous system and getting you moving better. I mean, his arms are fresh overhead now. He's touching his toes. Things are beautiful and opened up. And now I have a team where I'm like, hey, personal trainer, here's who you go to.
Yeah, that's really cool. And I thought you were going to say they were going to be like like having him stretch. I thought that's what you were going to say, like having him like, oh, just keep yanking on it and it'll get there. So like, how much of that well, like what you were doing with him was like literally trying like static stretching stuff, and how much of it was like just moving, and like what did your work with him look like?
Oh man, it's gone across the board, and it would be different with every client, but I do use particular massage techniques that run along fascial lines, because when we talk into, lines of the body working as a whole, it helps to feed back to the nervous system to also make you feel like, oh, elongated and safe and aware. And so I use those techniques which is more so along like myodetox. So if anyone's heard of that, in order to tap into the body. But again, that's like a manipulation. That's like an adjustment, and it's only going to last for a second. So you have to make sure that when you're using these techniques, you're following it up with movement. So allow your body to feel safe, allow it to go back into that position again, because there's not going to be any carryover. Adjustments, manipulations, and massage techniques are all just neurological. They only last for a moment. And that's what people need to understand too, because no one fixes you. You fix yourself. We're just facilitating the way. So I use a lot of those techniques to start to facilitate into the body. And then we worked on breath a whole lot. We worked on relaxation drills. We worked on movement patterns. So doing a lot of movement and triplanar motions to get his body to open up in all these different areas. And now he's doing weights and he's doing awesome.
Yeah, it's really cool how like these different things can work together, and just like somebody like the feeling safe thing, like saying like this trauma stuff keeps people that have had various traumas keep just kind of popping into my life, and I end up learning about it somehow. And I've reading stuff and just how it all works together, and like how much do you think, maybe it's like a little bit beyond your scope, but it sounds like you're already kind of on it, like just like talking about it, because I think the last book I was reading kind of mentioned that. So like when somebody's like working with you, so you're like doing your like physical stuff, and then like maybe they're like, so I don't know why they're crying or something like that, and like then do they like open up, and then like after they start talking, then you see more physical improvements after they just have like be able to like let it out.
Yeah, a lot of times it's releasing. And, I was just talking to someone the other day I did an Instagram live with, and he uses certain techniques that elicit someone's reactions in terms of, he tells them to like kneel in front of a bed and pound into the bed, and just this pounding action helps you to release some tension and some stress that you might be holding on to that you didn't even know about. He recommends screaming into a pillow and yelling into a pillow and just getting things out, because oftentimes we hold it in so much and we're like, it's fine, it's fine, it's fine, or whatever, I'm just going to brush it off, or F that, or whatever it may be. However we brush things off, we're actually storing it within our body. So instead of just releasing it and letting it come to the surface, not by yelling at someone, so yell into a pillow, do whatever you need to do, yell into your car, whatever it may be, but some way that you can release and just get the energy out. There's so many different techniques. I don't think there's one way to do anything. I have friends that use what's called morning pages, and they have 3 pages that they write in every single morning, and then they throw it away. So then you never have to come back to it. You never come back to those feelings, and you just release them. And it's like a morning practice. So it's whatever tool that you can find that you use within your body to release. And if you need to cry, go out and cry. You know, don't allow someone to tell you that you can't have emotions, that you can't cry, that they can't handle you crying. Okay, then go and step into the other room and cry, because, or take a shower and cry. It's okay to have these emotions that store in our body. It's human and it's normal, but when we hold on to them a lot, that's when they start to manifest in different areas, or they start to restrict, or you'll notice, like, even if you're doing yoga all the time, why am I feeling so tight? There's certain things that we're holding on in our emotional patterns that don't allow us to release.
Yeah, it's really fascinating. I think it's getting more common, or maybe part of it is like my age and the people that I talk to. I'm 39, but like a lot of, like, I've done martial arts for a long time, and like a lot of the toughest guys I know um, are they'll talk about their feelings. They'll talk about love and stuff. I mean, you got this guy can beat everybody up real easy, super tough guy, and he's not afraid to talk about love. He's not afraid to talk about his feelings. He's not afraid to talk about how, like, a girl broke his heart, or a problem that, and at first it's like it can almost be kind of confusing, but it seems like it can be maybe it's getting more acceptable now. Like, as guys, like, we're supposed to be stoic, and we're supposed to hold everything in. Got family to take care of. As a mom, it's not about you; it's about your kids. So your work, then you get home, you're making money for your kids, then you get home and you're taking care of the kids, and it's all about the kids. And then you don't have you can't complain, and so man can't complain, woman can't complain. But there's like all these, and then it comes out in all these weird ways. But it seems like now it's different. And like one of the guys I had on, Leo Savage, he's his last name is Urquidez, but he's changing it, and he's big into using the mace. He's doing like a lot of like flowing drills with the mace. I don't know if you're familiar with him, but he does a lot of interesting things. And so he was on, and he was talking about I thought he was going to say like heart problems, but he was like saying problems of the heart, like this breakup. And so he had like these things going on. So, but by using the mace and all these different movement patterns, like, it was able to like release that. So I was maybe like these new movement patterns are allowing us to open up new mental patterns, or psychological possibilities, or something like that. Because you're moving in all these different ways, it opens up these stored traumas that we didn't know about, and so maybe they can be processed physically without even having to do the mental work. Or does that make any sense to you, or like, what do you think of
It
it?
does, and I think it's going to be dependent on every person, and it could be, different times in your life where you're going to find releases in different ways. I think there's never a time where we release all our traumas. Some are going to hang on, but being able to be more aware of when patterns are coming on, or when traumas are coming on, or when traumas are presenting themselves, that's when it becomes really powerful to be able to learn the tools to kind of release in whatever way that means for your body. I personally have done a lot of personal development work where I've gone to workshops where it is very interactive and experiential, and having to do things that are physically releasing, which I think is so way more powerful than just sitting down and talking to a therapist. Not that that's not needed. I've done that as well, and it's helpful. I think everything has its time, but also when you can really dive in and do the work and do the experiences of whatever it may be for your body. So maybe it is a movement pattern. Maybe it is actually talking it through. Maybe it is yelling it out. Whatever it is for your body, I think we do get to learn where these are coming from, or we become victim to our body all the time. So are you going to be a victim to whatever's happening and these pains that continue to happen? I've met someone, and he's been on and off neck pain for 10 years, and he's just used to it. And I'm like, you're a victim to your pain. So are you going to be a victim to your pain, or are you going to dive in and do the work?
Yeah, and
And
so
that's where, taking on the responsibility of being able to do that becomes so important and diving in. And I think personal development workshops are amazing and so, so needed.
yeah. So when was he like receptive to this like new way of thinking about his neck pain that you were talking about, or was he resisting the? Because it can sound, I can see how. Um, I mean, I've been kind of like reading about this stuff and practicing this stuff for a long time, but I can see how somebody, like, especially if it's new to them, if they're like very like maybe Western mind, for lack of a better uh, word at the moment, they think, oh, that's just like this woo. It sounds like some yoga
Mhm.
teacher said that. It's ridiculous. There's no. Uh, was he receptive that it might be something?
Yeah, we didn't really get to dive into emotional stuff quite as much. I think he wasn't from in town, so I worked on him once. I think if he's a consistent client, we would have definitely dove into a little bit more. For him in particular, the one thing that I was going to start with was, yes, I got him into movements, but breathing, because he was really, really, really locked up. Like if I lift their arm and then I release and they don't just let it fall, it's a good indication that you're holding on. If when you can't just like let your body just flop and be. And that happens with almost every client. Almost every client, I'm like, we got to work into this like releasing pattern. And with him, he doesn't meditate or anything like that because, again, for a lot of people, that's going to be too woo-woo. So I ask him to just go into the breathing, because the breathing is actually something that you can, for analytical minds that don't want to do all this like weird stuff, it's a really easy way to just be able to say, okay, I don't want you to meditate. I want you to breathe and only focus on your breath, which essentially is meditating, but we're not using that word anymore. We're saying we're just focusing on your breath. Put your hands on your low rib cage. Where are you breathing into? What can you feel? Do that for at least 5 minutes. And so over time, I am actually getting them into that meditative state without having to go there, without having to say that. So I also sense, where are people at? If they like meditating, maybe we'll go into that way. If they're not really up for that kind of thing, maybe we'll just go into the breath work.
Yeah, that makes sense. Because if you have like if you're just hoping your one method works with all your clients, you're going to run into some walls, I think. And
Yeah.
yeah, well, I started as a trainer. I was 20 years old, and so I was working with people that were usually like twice my age, a lot more financially successful because they could afford me, uh, and like some of them, I would have like meditate at the end, or do like maybe some like qigong type of things, and they'd be. But there's other ones I wouldn't even bring that up, and because you're meditating in a personal training
Yeah.
studio where other people are doing like curls and stuff, and
Yeah.
finding the right um, uh, model to use for each one. So I guess like what do you see on the horizon? I know you have these online programs. Like what do you like see as next? Are there other areas that you're wanting to like dig into that look promising for whatever goals you have?
I really want to just continue to spread the message that no one else is fixing you. You fix yourself, and empowering people to dive in and tune in to their bodies. So I'm moving more into speaking and getting on stages as much as possible, to be honest, because I just want to continue to spread that message and spread it to the world. Um, because we do have all the tools within our body. A foam roller isn't going to help us. A tool isn't going to help us. There's no other tool besides what you have within yourself that literally will help you. People like me, physical therapists and chiropractors, we facilitate. So we can definitely take a bigger look at the picture and kind of get you neurologically back into your body. But if you're relying on someone week after week after week, they're not fixing you. They're not helping you, because there's nothing that we can do that breaks up scar tissue and does all these other crazy things that might be out there instead. It's really what you can do for your own body. And all it takes is tapping in a little bit every single day, because it's more about the consistency aspect rather than the amount of time.
Yeah, you were talking about, you mentioned the fascial lines, and you mentioned acupuncture, and like I kind of go back and forth because my thinking can get pretty much as esoteric as it can possibly exist in the world. I can have some pretty like far out kinds of thinking and like believe almost anything. But like, do you think there's like with the acupuncture? I guess there's like a couple kinds now. Like there's a couple different kinds. Like one's more like based on like a Western system of, I think it's just called modern acupuncture, and it's based more like on like the nerves and not necessarily like meridians. Do you have um, an opinion on like how that works, like acupuncture, like whether it's really like meridians? Like, do you believe in like that system, or is it more like nerves, and like does that relate to the fascial lines?
So I believe in both. Whatever works for whatever person. I don't think there's one technique, one thing that's going to help anyone. And if one thing isn't, if you're not feeling it within your body, you're not feeling like this is actually helping and facilitating anything, to then go to someone else. I think there's also a power in movement. So yes, go get acupuncture and have your energy moved and things, because I believe in energy. I believe in that's super powerful within the body. So I do think that it plays a role, and if acupuncture can help in whatever way to guide that and facilitate that, that's amazing. But also move after. If you're going to go get a massage, move after. If you're going to go see a physical therapist or a chiropractor, don't just get the adjustment, don't just get an ultrasound. Make sure that they're giving you powerful movement tools as well to tap into your body. So I mean, movement is the key to everything, and I think whatever can facilitate that process and get into different energy lines, that's amazing. I personally, I haven't even done acupuncture yet once, which is crazy to me. But I've heard amazing things. And then for other people, I've heard it doesn't work for them. So I think, to each their own, and there's no one way, there's no bad way.
Yeah, I've had it done once, and I was like hoping for something that didn't happen, I guess. But because I can feel different things in my body, like the microcosmic orbit. I don't know if you're familiar with like Dallas system stuff. I can actually feel that energy moving around. But let's see. Oh, you mentioned the Myo Detox. I know we're getting close to about an hour here. I can let you go pretty soon. I'm sure you're busy, but you mentioned Myo Detox, and if you could explain what you mean by that.
So Myo Detox was created by my friends Vinny and Scott up in Canada. Vinny Rehab is a very popular rehab page out there on the Instagram world, so people might know him from there. Really, their system of doing manual work is really based on fascial lines and functionally using that into the body to tap into the nervous system. And then he uses different movement patterns that hit different triangular patterns and movements, so that we again start to rebalance what's happening within our nervous system and get our body to kind of rebalance on its own. So his belief system is like, if you're tilted to the right, push into the right and into the left, like go to both ways, because when your body starts to feel both extremes, we start to find the balance in the middle naturally without forcing anything. Because a lot of times what is popular and what is out there, if you have rounded shoulders, do retraction and just pull it back, but all that's doing is just forcing us into a position our body isn't used to being in. But instead, if we're able to bounce between two different directions, we're actually allowing the body for itself to find that balance in that and kind of rebalance itself. So again, it's just a facilitation pattern. We're all just facilitating the body in order to be functioning at its best so that we can live longer and go into longevity.
Yeah, that makes sense. I'm going to have to look more into it. I did see him. You mentioned him on your Instagram. I think I am about out of questions for. I could just keep like digging and digging, and you have a lot of interesting knowledge and a lot of good experience, but I don't want to hold you up for forever here. Is there anything else you wanted to get into, or any like last thoughts for us?
No, I think if people just want to learn more, they can go to my Instagram, DocJenFit, and I have tons of videos on there, and that's where I provide my link is with my programs as well. So the mobility methods where you can really start to dive in and take a look at your own body, which is the most powerful thing you can do. So I really encourage people to dive into their bodies. And then the optimal body is a way for you to be able to have multiple tools at your fingertips for $15 a month, so it's pretty cheap. And I'm really a hackler on form, so I show videos and I verbalize everything because I'm like it. I'm so big on form. Feel it within your body.
Yeah, it is really good. I looked at quite a bit of your stuff, and of course, I saw you before I invited you on the show, and then leading up to it, I was looking even more, and you have a lot of really cool things going on, like the handstand thing and the all sorts of neat things. So yeah, well, it was really nice hearing more about you, and I think there was a lot of good stuff in there. So I will let you go, and I will talk to you for just a minute once we're done recording. So thanks for coming on.
Thank you.